GLP-1s are exploding in use,
Yeah.
right? So I
Yeah.
remember when people first started using them, like was coming out of diabetes patients who like, I lost a lot of weight. I'm on this GLP medication for diabetes. And then it started to become mainstream for people to lose weight, right? So they were specifically using it as a weight loss, which is not really fully indicated for, but people are going to do what they want to do to lose weight. And some people are on it for the right indications. But I remember when it was just a few patients that had lost weight from this. And then suddenly it was a lot of patients. And then it felt like it was like every patient. And it's probably not. It's probably about like 12% of the US population is on a GLP, which is a crazy, crazy number if you really think about it. And so now we really have to contend with like what is the proper thing to be doing while you're on a GLP? If you're going to be on a GLP for whatever reason, medically indicated or not, what is the best way to basically support your health while you're on this? And so the main thing that we were seeing was termed Ozempic face, and they've come with all different terms for this at this point, but it really is just due to rapid weight loss. And we used to see it when people would get gastric bypass too, but it was so infrequent that we never really like thought to name it anything. But now that it's 12% of the population, we have to really we have to really contend with this. Like, what does it really look like? And this is something dermatologists actually don't probably know enough about or spend enough time thinking about because we've never really had to contend with it. But there's also a nutrition element to this that I think is actually very important as a layer, right? Because I could talk to you all day about the skin stuff that's going to happen, and we'll talk about that next. But there's a nutrition layer here, right? About getting enough protein, because you're not going to want to eat and you're going to be losing a lot of weight, and you need to be making sure that you're getting the right nutrients. So you have to have the right, amino acids that you're taking, the right other supplements that you're taking that maybe you're not getting. You need to be getting enough protein, for example, right? Because there's going to be a lot of muscle loss that happens during this period. There's going to be a lot of fat loss that happens during this period. So there's a nutritional layer that's actually very important here. And I think anyone that's on a GLP really needs to optimize their nutrition while they're on it because you're eating less, but what you're eating really then matters, and making sure that you have a balanced diet, that you're not under indexing on any particular really essential elements of your diet. So that's one layer that I think derms need to talk about and need to be part of the discussion when you're treating someone who's on a GLP.